of carbonic anhydrase inhibitor or acetazolamide. First side effect is hypokalemia. Why hypokalemia? This drug is also responsible for more excretion of potassium. If potassium excretion is more, so ultimately level of potassium is decreased in your blood, so hypokalemia is there. This drug is also responsible for drowsiness. Drowsiness we already that this reducing the it will increase in the carbon dioxide level in your brain or reducing the pH level. So slightly it will be responsible for sedation. That's why drowsiness is there. Presthesia means what? If you are taking this drug, so if person feeling like someone is pricking to their skin or their body. If pin pricking feeling is there, that thing we can consider as a presthesia. Fatigue also that is there, development of fatigue is there, abdominal pain or abdominal discomfort if there, the side effect. Hypersensitive reaction is also there, skin rashes or type 1 hypersensitivity, or we can call as a allergic reaction is there. Bone marrow drug also depress your bone marrow. And last one, this drug is contraindicated in liver disease. Okay, so these are the some side effect, adverse effect of acetazolamide. Diuretic. Why we are using potassium sparing diuretic? See, we already discussed that diuretic, most of the all diuretic is responsible for more excretion of potassium. जब potassium का excretion ज़्यादा बढ़ जाता है, so in that condition we have to save the potassium. See, potassium का excretion बढ़ गया, so potassium level is decreasing in your body. So at that condition we have to save potassium. So if we need to save potassium, we can use potassium sparing diuretic. We can also put in potassium savior. It save the potassium. How it save the potassium, we'll discuss it. So in that first category is aldosterone antagonist, or drug is spironolactone. Okay. So normally what are the action of this drug we will discuss. First thing we will discuss the action of aldosterone. If you aware the basic physiology of aldosterone, if you aware the basic function of aldosterone, so you can easily explain the aldosterone antagonist. Okay, or you can easily explain the function of spironolactone. Okay, so normally what will happen, we already aware aldosterone, actually this aldosterone is releases from the adrenal gland. Adrenal gland से आपका aldosterone release होता है और it enter in your kidney. Normally what will happen, it will bind when it will releases from the adrenal gland, it will enter in your basolateral membrane of your last part of your kidney, collecting duct के basolateral membrane पे जाके work करता है और it will normally enter in your basolateral membrane. See, where it will react with their receptor. Their receptor consists of two important domain, that is DNA binding domain or hormonal binding domain. This drug is bind with their hormonal drug binding domain. It will bind with a particular receptor, or this receptor is enter in your nucleus, where it will bind with the DNA specific region of DNA enhancer region. So drug or receptor, when aldosterone bind with this receptor, this complex thing will translocate in your nucleus, where it will bind particular DNA specific region. So due to binding of DNA, what will happen, transcription process is started or mRNA is synthesized, and this mRNA is come out in your cytosol. This mRNA is responsible for the synthesis of new protein. Name of protein is aldosterone inducing protein. Okay. See, due to aldosterone what will happen, न्यू प्रोटीन इज सिंथेसाइज. जब अल्डेस्टेरोन वर्क करता है तो अल्डेस्टेरोन की वजह से अल्डेस्टेरोन इंड्यूसिंग प्रोटीन का सिंथेसाइज करता है, एंड दिस अल्डेस्टेरोन इंड्यूसिंग प्रोटीन इज नॉर्मली रिस्पॉन्सिबल फॉर द सिंथेसिस ऑफ सोडियम चैनल. ये क्या करता है, सिंथेसिस करता है सोडियम चैनल. एक्टिवेशन ऑफ इनएक्टिव चैनल, जो इनएक्टिव चैनल्स होते हैं उनका एक्टिवेशन करता है. देन इंसर्शन जो हुआ पुश करता है चैनल्स को सरफेस पे, इंसर्शन और पुशिंग दी जो वट एवर द चैनल ऑन द सरफेस. इट आल्सो रिस्पॉन्सिबल फॉर सिंथेसिस ऑफ सोडियम पोटेशियम ATPase, or it also responsible for the synthesis of potassium channel. Okay, so these are the synthesis of these channel. Means what, first thing it will be responsible for synthesis sodium channel, synthesis of potassium channel, activation of inactive channel, pushing of channels and so synthesis of sodium potassium ATPase. Okay, so due to this thing, suppose sodium potassium ATPase is there, then so synthesis of sodium channel, so what will happen, more and more sodium is reabsorbed. इससे क्या होता है, सोडियम का रीअब्जॉर्प्शन ज़्यादा होता है और पोटेशियम का एक्सक्रीशन ज़्यादा होता है. सी वंस वी आर यूजिंग एल्डोस्टेरोन एंटागोनिस्ट, सी दिस इज द बेसिक फिजियोलॉजी. ड्यू टू एल्डोस्टेरोन more channel is synthesized. If more channel is synthesized, more reabsorption of sodium and more excretion of potassium. So if we are using aldosterone antagonist, the name of drug is spironolactone. Spironolactone, what it will do? Simply it will block aldosterone receptor. So what will happen? Aldosterone is not binding with aldosterone receptor. If aldosterone is not bind to aldosterone receptor, so what will happen? Translocation process is inhibited. If translocation is not there, so no more mRNA is synthesized. If mRNA is not synthesized, okay, so what will happen? Not aldosterone inducing protein is there. If aldosterone protein inducing, this protein is not synthesized, so synthesis of this channel is not there. If synthesis of sodium channel or other channel is inhibited, so no more reabsorption of sodium. If sodium is not more reabsorbed, suppose in this area what will happen, suppose this is your basolateral membrane, and when sodium is reabsorbed, जब sodium reabsorb होता है, तो with the help of sodium potassium ATPase, sodium is go inside of your blood, or potassium concentration of potassium is increases in basolateral membrane. If potassium level is increases, so with the help of potassium leakage channel, more and more potassium is coming out or it will appear in urine. So these things get blocked. Normally क्या होता है कि जब सोडियम ही reabsorb नहीं होगा, so what will happen? This sodium potassium activity of sodium potassium channel is active, enzyme is inhibited. If in this activity is inhibited, so level of potassium is reduces in your basolateral membrane and the excretion of potassium is inhibited. In this way we can save the potassium. Okay, very simple mechanism is there. It will block the aldosterone receptor. So if aldosterone receptors get blocked, so no more interaction of aldosterone receptor and no more synthesis of new protein. That is, aldosterone inducing protein is not synthesized. If these protein is not get synthesized, अगर ये protein synthesized नहीं होता है, so what will happen? Synthesis of sodium channel is not there. Activation of inactive channel is not there. Channel pushing is not there. Synthesis of potassium channel is not there, and synthesis of sodium potassium is ATPase is not there. So this channel is not synthesized, which will be responsible for reabsorption of sodium. If sodium is more reabsorbed, so if basic phenomena is that if sodium is more reabsorbed, which will excreted more potassium. So we are blocking this reabsorption. If we block the sodium reabsorption, ultimately potassium gets saved. Okay, so in this way we can explain the action of potassium sparing diuretic aldosterone antagonist. Name of drug is spironolactone. What are the uses of aldosterone antagonist or spironolactone? Uses, the first use of this drug, we can save the potassium. If we are using other diuretic, if we are giving the patient to other diuretics like thiazide and loop diuretic, so due to utilizing of this diuretic, more excretion of potassium, more loss of potassium. So in that condition, we can save the potassium level. If more excretion, if hypokalemia is there, so in hypokalemia we can effectively utilize this aldosterone antagonist or this spironolactone. Second, as we already aware, we can also utilize in edema. As we already have, fluid accumulation is there, fluid retention is there. So in that fluid retention, development of edema is there. So in this edema we can also utilize this drug. Hypertension, we already have what is the hypertension or how drug is utilized in hypertension. Heart, we can also utilize in heart failure, or we can use in primary hyperaldosteronism. If aldosterone is more in someone's body, so we can effectively manage this symptom. Last point with spironolactone, that is interaction. What are the different interaction? So first thing, we could not combine with potassium supplement. We could not combine spironolactone with potassium supplement. Why we could not combine? Because potassium, if you are giving the extra potassium, So what will happen? Chances of hyperkalemia is there more because spironolactone also saving the potassium, or if you are taking the additional potassium, these two things will be responsible for hyperkalemia. So potassium level is increasing in your blood. That's why we are normally not giving potassium supplement along with spironolactone. If you are giving aspirin, so aspirin normally block the action of spironolactone. How aspirin block it? By simply it will inhibiting the tubular secretion. Aspirin's tubular secretion को of spironolactone is engaged. Aspirin क्या करता है? Spironolactone के सुबह tubular secretion को inhibit करता है और उसके action को inhibit करता है. If you are taking AC inhibitor, this drug spironolactone, अगर spironolactone को AC inhibitor के साथ या फिर angiotensin receptor blocker के साथ combine करते, so what will happen? Chances of hyperkalemia is there. Okay, so normally we are not prefer with AC inhibitor or angiotensin receptor blocker. Why it is so? Because it will increases the chances of hyperkalemia. This drug, if you are combined with digoxin, so it increasing the plasma concentration of digoxin. Spironolactone giving with digoxin, so plasma concentration of digoxin is increasing. So these are some possible interaction of spironolactone. First effect of spironolactone, that is drowsiness, is there. Ataxia. This drug is also responsible for ataxia. Ataxia means what? Impaired balance. Because impaired balance or impaired or coordination means what? This drug is blocking, damaging the nerve, brain nerve. So due to damaging of brain nerve, incoordination is there, imbalance is there. Okay, mental confusion is also there. Why it is so? Because this drug is damaging your nerve, brain nerve. Epigastric distress is also there. Loose motion is there. Gynecomastia, guys, it is so because this drug is inhibiting the increasing the conversion of stirred oil, or it will increase the excretion of testosterone. This drug is also responsible for erectile dysfunction or loss of libido is there. These are some possible adverse effect of spironolactone. That is renal epithelial sodium channel inhibitor. Renal epithelium sodium channel is there, sodium channel. So its main name self-indicate, it will block sodium channel. See, due to blocking of sodium channel, what will happen? Sodium is not get reabsorbed. Sodium reabsorption phenomenon is also affected, or it will also saving the potassium level. This drug is also saving. How potassium is saved? If you are blocking the sodium reabsorption, so what will happen if sodium is not reabsorbed? So this sodium potassium ATPase will not activate it, because in your basolateral membrane concentration of sodium is increases. So what will happen? Your sodium potassium ATPase throw sodium outside of your basolateral membrane, or take potassium inside of your basolateral membrane. See, if concentration of potassium is increases in your basolateral membrane, so positive repulsion or potassium leaky channel is there, and more potassium is excreted. So simply renal epithelial channel, this channel simply block the sodium channel. If sodium channel is get blocked, so more excretion of potassium there, or we can also save the potassium. So in this way we can explain this mechanism of action of this drug. Now next category is osmotic diuretics. Category is osmotic diuretic. This drug, its name self-indicated, it will increase the osmosis or osmotic. What is the mechanism? Drug is mannitol. Normally mannitol is given IV we can inject this drug direct enter in your general circulation. जब general circulation enter होती है, so what will happen? Whatever your intracellular fluid is coming out in your extracellular fluid, जब भी हम लोग देते हैं, so what will happen? Whatever the intracellular fluid is coming out in extracellular fluid, so expansion, volume expansion is there. Extracellular fluid का expansion होता है, volume expansion is there, और due to this reason your renal blood flow is increases. Whatever the your blood flow towards your kidney, renal blood flow is increases. If renal blood flow is increases, so it also affecting your RAS system. It decreases the RAS, renin-angiotensin system. It decreases sympathetic tone. See, when renal blood flow is increases, so more load is in your kidney. So your kidneys could not handle this more load or less reabsorption. More load is not handled by your kidney. That's why whatever that fluid is more excreted in your urine, or more water excretion in your urine. In this we can explain the mechanism of action of osmotic diuretic. This drug increasing the when we are injecting, so whatever the intracellular fluid coming out, extracellular volume expansion is there, or this more volume is entering in your kidney, so your kidney is not handling this extra load, or whatever the extra load finally appear in your urine. In this way rate of urine formation or rate of excretion is increases. So in this way we can explain the osmotic diuretics.